See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
The American Nurses Foundation commissioned the first study of nursing and philanthropy. So then what percentage, all private donations actually support nursing? And, the headline is 1 penny of every dollar. How could that possibly be?
We still are a country that spends more on healthcare, and we are not getting the return on investment on our health outcomes.
There's 2 million open jobs, and that's only expected to double in the coming years. Many of those are in nursing.
Whatever impact we can make in either nursing education or nursing workforce or nursing perception, it will impact every single individual nurse.
So one of the first things we did in looking at the strategies and going back and reflecting on our learnings was developing this mapping of what we call a nurse's journey.
When you provide the right opportunity for nurses to excel, patients gain in every way.
Our approach is really that we test something out with our philanthropy, but that private institutions take it over or makes a case for federal government. And we have seen that in a lot of other programs.
This is a comprehensive partnership. This is with Bloomberg Philanthropies and their investment. They provide assistance with strategy, with resources. They're a thought partner. They're a cheerleader. They've built infrastructure.
If you looked at all the dollars that are given in healthcare and imagined, well, what if 20% of that went to nursing? It would be mind-boggling.
Welcome to See You Now. I'm Shauna Butler. 1 penny. Can you believe that? Only a penny of every healthcare philanthropy dollar goes to nurses. If you're scratching your head wondering how that makes sense, you're not alone. Everyone has benefited from the expert care of nurses who are essential and indispensable to healthcare. Transformation of our complex healthcare systems requires vision, innovation, a commitment to long-term change, as well as substantial funding. Philanthropy will be crucial in creating and scaling positive change, which is why the American Nurses Foundation commissioned the first of its kind report to understand the landscape of philanthropic support for nurses and the nursing profession. In the second of our multi-episode series on investing in nurses, we bring you rare, in-depth, unscripted conversations with philanthropists, fundraisers, program managers, executive directors, grantees, and innovators behind these creative, strategic, and evidence-based approaches to investing in nurses. Learn why it's so impactful and why it's so urgent.
My name is Pam McHugh. I'm a registered nurse, PhD prepared, and I'm the founder and chief executive officer of the nonprofit organization Nurses Middle College, or Nurses MC. We're the only public high school network focused on nursing, developed by nurses, led by nurses. Nurses MC's groundbreaking model addresses 2 critical pain points: the critical need for more nurses and the critical need for more diverse nurses in our workforce to improve patient care. Nurses MC offers students a tuition-free, rigorous college prep education, free college credits. Our students are mentored by professional nurses at all different grade levels. They have work-based learning experiences, clinical rotations, and they earn a patient care workforce certificate. The Rhode Island School serves 500 students from grades 9 through 12. In the Future of Nursing Report 2020-2030 by the National Academy of Science, Engineering, and Medicine, the Rhode Island School was highlighted in that report as an impactful model, increasing the diversity in the nursing workforce, but also in improving health in this country, moving this country to more health equity. We are also the recipients of a generous investment from Bloomberg Philanthropies to replicate our model in Nashville, Tennessee, with our lead partners, HCA, TriStar, among others, Vanderbilt University, TSU, National Healthcare Corporation, Ascension St. Thomas.
My name is Jenny Kane. I work at Bloomberg Philanthropies, and I'm responsible for our new Career and Technical Education Healthcare Initiative, which we launched in January 2024, which is a $250 million investment in 10 locations around the country to help build new innovative high schools to train young people for growing healthcare careers. Bloomberg Philanthropies invests in 700 cities and 150 countries around the world in fields such as arts, education, environment, government innovation, and public health. In 2023, Bloomberg Philanthropies distributed $3 billion in grant funds. I've been working in this space for almost 20 years. I care passionately about helping young people to gain opportunities that they deserve, that they might not have been exposed to. I worked at City Hall with Mike Bloomberg for several years before starting at the foundation and gained knowledge about the policy arena and how to connect public and private philanthropy to maximize impact. I'm really excited about this program because I think it addresses a need and it is innovative in this career and technical education space.
So when Bloomberg Philanthropies announced this very thoughtful approach to a workforce initiative that is focused on nurses, nursing education, nursing placements, hospitals, it came out of the education department. So how does nursing end up over in education in your portfolio?
Yeah, it's a really good question. We started a bunch of different programs in 2016, 2017 to help high schoolers who might not be bound for four-year college get the credentials and certifications that they need to go directly into the workforce. And what we were hearing over and over again was that healthcare was the industry that needed the most workforce, both in terms of allied health professionals and nurses. So we started thinking, what if we could create a program to train more people for these jobs? We know there's 2 million open jobs, and that's only expected to double in the coming years. Many of those are in nursing, as well as other allied health professional roles. So we started thinking, let's look at healthcare. We had conversations with around 20 hospital CEOs around the country to say to them, is this really a need, what we're hearing out there? And each of them said, yep, we have, between 2,000 and 6,000 openings. We're having to close down hospital beds. We're having to hire visiting nurses. We need nurses so desperately. We need other allied health professionals so desperately. And it really corroborated our thinking around this as a focus of our education programs. Mike Bloomberg believes that everyone should have the options and opportunities to go directly into the workforce or four-year college, whatever makes sense for them, but they should be able to pursue a career with family sustaining wages. And these healthcare jobs have family sustaining wages, and they also have the opportunity to build upon them, to gain additional credentials and certifications, to get additional degrees, and then also to get a higher salary over time. So we thought this was a great place to focus on.
There are several reports out there. One of them is supported by the World Health Organization, but one of the things they talk about, and it's called the triple aim, and that when we invest in nurses, not only do we address the wealth generation, but we also get healthier communities. So What did you hear about that?
We definitely heard that. We heard over and over that by providing work training programs and helping to make those communities healthier and safer, that it was critical that the nursing and other health professionals more reflect the communities that they were serving, and that would lead to better health outcomes as well.
So Pam, what's the current state of the nursing workforce? And then let's move into what are the needs going to be?
So yes, the nursing shortage is a major crisis plaguing hospitals and healthcare settings all across this country. And while the Journal of American Medical Association reports that in 2019, the number of full-time RNs tripled, that is not nearly enough. That's only about 9.6 RNs per 1,000 U.S. residents. And nursing shortages lead to burnout. And we know that there's a significant shortage all across the country, but it's not just about the numbers of nurses. We need to now look at the composition of the nursing workforce. Our country's demographics they're diverse and becoming more and more diverse. But our current nursing workforce has not reflected those demographics. Patients do better when their nurses and healthcare providers understand their language, come from their communities, their cultural backgrounds. And nurses work at all levels within the healthcare system and in the communities. So when you do not have enough nurses across the entire healthcare spectrum, you're going to see hospital beds closed, surgeries delayed, people not having access to primary care. That is why we nurses are so concerned about our future workforce. And that's why Nurses MC said, are we going to wait until students develop an interest, come to us in college? How can we develop our own workforce? So it is extremely critical. And it's not just for us as nurses, but all of us as a community and patients.
So let's tie those things together, Nurses MC and the projected workforce. And how does Nurses MC think about, and more specifically, design for and help address the nursing workforce that we need now and in the very near future?
So the Nurses MC model, it's an investment in the workforce. When we look back at the biggest barrier to nursing and health professions, lack of diversity, as you look down the educational pipeline, the biggest barrier to students who are currently underrepresented is the pre-collegiate pipeline. It could be public education exposure. Students stop beginning to think about career opportunities as early as middle school. And when they enter high school, that is a critical time in their educational pathway. So that is why we need to get to students earlier, as early, that's what the nursing middle college model, as 8th grade, 9th grade, begin to develop their interests, their academic preparation, expose them to work-based learning opportunities, let them know the unbelievable opportunities that a career in healthcare and nursing can afford them. And then they're on their career trajectory. Specifically for our model, we're targeting students who are currently underrepresented in the nursing workforce. So we're serving students who they are first generation high school graduates, let alone be the first to graduate from college. So this is also intentionally designed within the nursing middle college model to lift these students up. So in our Rhode Island school, 94% of our students qualify for free and reduced lunch. And 82% of our students are Black and Hispanic. And when they come to us in 9th grade, only 10% of them are performing at grade level. In 4 short years, we have a designed intentional curriculum, not only to get students performing at grade level, engaged and passionate about nursing and healthcare with our work-based learning experiences, and mastering college level coursework, that for the past 6 years, Rhine Nurses Middle College is the #1 school in the state for students, college and career ready, earning college credits and workforce credentials. So we see that comprehensive approach, early engagement, exposure to the profession, academic foundation, mentorship, leads to enrollment into programs, persistence, degree completion, and entry into the workforce. And our specific model at 12th grade graduation, which is unique, we say our students are college and career ready because they have the academic foundations, they've obtained the college coursework and mastery of it, but then also they can go directly into the workforce as an entry-level patient care role as they continue their education. And that's the return on investment. That's a return on investment to healthcare partners, that community. So that is how we've designed our model, which is unique. We've done a lot of research. This is an evidence-based model.
It really is unique, the Nurses MC model. And in our earlier conversations, one of the things that you said that I had you pause because I wanted to write it down when you said we deliver education through the lens of health. Wow, like why have we not been doing this all along? And another point that you made that I thought was so powerful, you talked about education equity. We talk so much about health equity, but there's a lot of education disparities and inequities that then leads to students aren't prepared, even if they knew about and wanted to seek out nursing or a healthcare profession, they're not prepared.
We want to make sure that we're meeting the students where they are. Now, many of our students may have not been well served in their public school that they're coming from. So we believe that it has more to do with educational opportunity than just intellectual ability. We call it an individual learning plan, but from our perspective, it's a nursing care plan. So we provide them with, they have the academic program, but how can they best access the academic program? And we really look at, when we say delivering education through the lens of health, we're looking at those social determinants of health. We're looking at food insecurity, housing, access to health care, transportation. Are there siblings at home? What can we do and connect you to community resources, our healthcare partners? It's not just students. We embrace the whole family. For example, we had a family come to us and enroll, and part of that, traditional schools were like, oh, we need a physical. Well, we found out that they were new to this country and they did not have access to primary care. So what we do in the nursing middle college model is we immediately connected them with one of our healthcare centers, and not only to get the physical for the child to enter, but for the whole family to have access to healthcare. So that's one of many examples of how it's this comprehensive approach. And so we remove the barriers so the students can then access their academic program, and it's the whole entire family. And that has been part of the proven success and recipe of the model.
So Jenny, I'm looking at you and you are smiling and nodding. You're evaluating all sorts of educational delivery approaches. Do you want to jump in and
When we thought of this idea, we were trying to see if anyone was doing it around the country. Like, does this exist in any form or fashion? And there are a lot of schools that have some sort of healthcare pathway, but they're not necessarily directed towards a specific job, and they're not necessarily connected to employment. And Nurses Middle College stood out as the only example that we thought was really aligned with our approach, which was to integrate it into the whole school trajectory. And then you're really very well set up, like Pam said, to go directly into the workforce, or if you want to work and study at the same time, or if you want to go and pursue a BA to be an RN, that's great too. So all these options for students. And I think that Nurse Middle College is, in our new portfolio of these projects, is the only school that we're replicating. Pam's really a leader in this space and an innovator.
That's a good place for you to talk about the $250 million initiative.
Really, we view it as an education initiative because it's all within high school. And we want students to have the option of going to college or going directly into a career that is actually long-term family sustaining wages and has opportunities for growth. So this initiative, we asked high schools and hospital systems to come together to design innovative programs that would design the curriculum for the high school, provide very specific work-based learning, paid work experience at the hospital system, and then jobs at the end. We're working around the country, New York City, Philadelphia, Charlotte, Durham, rural geographies, Houston, Dallas, all working with major healthcare systems that have very acute needs in the thousands, and they are the major employer or one of the major employers in each of these cities. And it's a really intensive, in-depth partnership with these schools. This is not like coming for a day and doing a presentation or a one-day shadowing. This is teaching within the schools, designing the curriculum, like I said, providing paid work experience, and then basically guaranteeing a job for anyone that successfully completes the program. All of the geographies are also partnering with a local community college to provide the credentials and certifications for either different allied health professional roles like radiology technician, a medical assistant or nursing assistant, phlebotomist, x-ray technician, as well as four-year colleges if a student wants to pursue an RN degree. In all of the geographies, students will be ready to enter the workforce or pursue post-secondary immediately following graduation with the opportunity to work directly at the hospital system.
We were absolutely thrilled when we received a phone call from Bloomberg Philanthropies that they were interested in learning more about our model. And Jenny and her team came to visit us. And then we received an invitation to submit an RFP. And it was quite an exhaustive application process. It was rigorous. So it was not a shoe-in, but and so we were thrilled that we were selected, but even more so thrilled that this is a comprehensive partnership. This is with Bloomberg Philanthropies and their investment, not only in the Nurses Middle College, but in this space. They provide assistance with strategy, with resources. They're a thought partner. They're a cheerleader. They've built infrastructure. So the partnership and investment has absolutely been, extraordinary and much needed. And so that is really what the key to success. So again, I cannot say how thrilled and appreciative we are to have a partner such as Bloomberg Philanthropies.
Say more about Nurses MC and the ability now to start scaling that model, taking it to new places with this support.
Yes. So we are in a growth trajectory. We've had 11 years of evidence-based proof of concept in Rhode Island. So what we have found is that 100% of our students earn 3 college credits. That majority of our students earn 12 more. And we've brought down the prerequisite courses into the high school, what we call in nursing the gateway courses, anatomy and physiology, some of the most difficult courses. You can't pursue a nursing major unless you get through your prerequisites. Is it too early to bring that college coursework in, or is it the right thing to do? Our data points are our kids are making the grades. And it's not just passing. You need to get a B in anatomy and physiology. So some other things, 100% of our kids are graduating with a workforce credential, a CNA, and some are graduating with 2, the EMT. 75% of our students are enrolling in college within 2 years. What we're finding, the college and career readiness at 12th grade. Some of them are working in the workforce the first year with our healthcare partners, and then they're paying their tuition to go to college. As of 2022, we've had 384 graduates. 60% are college grads and or working in the nursing workforce. And the majority of them are still in the pipeline. Now, we had an anomaly with COVID because many of our students took a gap year from college, but we saw them go back into college. So we know that the model is working. And we know Rhode Island is not the only state experiencing this critical nursing shortage. And we are looking to grow and expand the nursing middle college in any region or part of the country that has the demand.
Last year, the American Nurses Foundation released the first ever report that looked at philanthropic support for the nursing profession. And I think I intuitively knew that out of all the philanthropy that goes to healthcare, that such a small amount goes specifically towards nursing. I'm curious, Jenny, Pam, were there any things in this report that stood out to you that resonated or said, yes, we're on the right track in how we're thinking about making investments in nurses and nursing?
No, I mean, I think that like all the reports that we saw around healthcare workers corroborated what we were thinking about. And like Pam said, I think that COVID honestly changed, I think, people's perception of the necessity of four-year college. Not that four-year college doesn't have a lot of benefits, but for some students, it might not make sense. And they might graduate with a lot of debt or not finish college and then be without a degree and with a lot of debt. So I think it just shifted people's perception about the value and about potentially the value of going directly into the workforce, or more likely going directly into the workforce and continuing to earn a post-secondary degree while they work. More than half of the country does not have a four-year degree, and we just want there to be equity of outcomes for students who do pursue or graduate from four-year college and those who don't. And for those who do go to four-year college, that is more directed towards their interests. We have just found that students really want educational experiences that are applicable to their long-term objectives. And students get very excited in these types of opportunities. These types of programs increase graduation rates overall and go into a specific career that will have a better financial outcome for them. For a long time, people really viewed it as like college or career, but we're saying do it at the same time. Make money, get your degree, and then continue to get other stackable credentials over time so that you can continue to get a higher wage and be in a much better financial position.
When you look at the types of grant requests and the investments and the initiatives that you fund and support, what do you think are those ones or the elements of an investment that can produce broad and very sustained impact?
The role of philanthropy, particularly how we view it, is to help sort of de-risk a project up front. When you prove out the efficacy of a project, that it's not funded by philanthropy in perpetuity. That is the case in this program. We're asking the hospitals to be on the hook after our first 5 years of funding so that the hospital systems will see a real ROI on this program and say, this is something we should be doing forever. And that other hospitals around the country say, this is something I should be doing. And then without private philanthropy, because they've seen the test case that this works, pick it up on their own. Our approach is really that we test something out with our philanthropy, but that private institutions take it over or makes a case for federal government. And we have seen that in a lot of other programs that the federal government starts saying, this is something we should be investing in. The states, the cities, and we've already seen that in many of our programs that, it goes into the city's budget. There's a federal grant that supports it. We've been able to leverage a tremendous amount of government funds once we've been able to prove the model through private philanthropy. And I think that's, really a effective use of philanthropy and something that pervades a lot of our programs.
There is wild agreement across so many organizations, plenty of evidence, people saying that we need to invest in nurses. If we delay this or we don't make massive investments, there's a real heavy cost. What are the things that you worry about that you want to make sure that people understand? This is a very high stakes game. We can't delay anymore and we can't do small. We're overdue for urgent and massive investments in nurses and nursing.
If we don't invest in nursing and our future workforce and healthcare, we're already at crisis levels now with our shortages in healthcare, and it's just going to get worse. And we still are a country that spends more on healthcare, and we are not getting the return on investment on our health outcomes. So I think that the good news is that we are here today. And Shauna, you are highlighting investing in nursing, and Bloomberg Philanthropies, I'm investing in nursing, and nursing's here to carry that torch. So I think we're all here because we see the opportunity, the challenge, the need, but today we're doing something about it.
I think it's really important that we can bring a spotlight to this because, it is a big national investment, but it is then the responsibility of the private sector that desperately needs this talent and the federal government that wants to support job development programs and helping people to gain family sustaining wages to continue to support this work and invest in this work. So, I'm really excited about these projects. Our hope is that this is really a testing ground where we take best practices that work in various different programs. We codify information, we share information with other locations, and they see what success looks like. They see the return on investment for the healthcare system, and they do it themselves.
So making these smart investments is so important. And Jenny, when we think about our financial partners, whether it's from the philanthropy side, the government side, the fact that they've taken the time to understand the nurse's career, the nurse's work, the nurse's impact, we see the action, we appreciate the investment, and I promise you, no doubts whatsoever, we're going to make you proud, and you're going to be thinking, how do we do more of this?
Yeah, I have no doubt too. Very excited.
So the impetus of this model is really a health policy initiative. And we are seeing, especially with our Rhode Island school, is having an impact on the community financially. These are stable healthcare jobs. We say college and career ready. So at 12th grade, they have an entry-level patient care certificate, but then we're preparing them for a profession with unlimited opportunities. So that's going to provide our students and their next generation economic stability and maybe the reliance on certain communities of public assistance. We know our graduates, many of them, are out earning their parents as soon as they graduate from high school. And in diversity and career, our students are representing the diverse multicultural landscape. We're impacting and we're contributing to increasing the diversity of the nursing profession. And our graduates, they are now pursuing postgraduate degrees. They're the future nurse practitioners. They're the future chief nursing officers. They are our future college professors on nursing professors in education. They are our future leaders. And some of our students pursue other medical specialties, which are contributing to the impact. So we believe that this model, this high school, does have bigger implications. It is a health policy initiative, and that is why we feel very strongly, because if we're having this impact in Rhode Island, can you imagine if we had nursing middle colleges across this country, the impact that we could contribute to the health of this nation?
Nurse Pam McHugh is the founder and CEO of Nurses Middle College, best known as Nurses MC, and Jenny Kane oversees Bloomberg Philanthropy's $250 million Career and Technical Education Healthcare Initiative. Building on that audacious and achievable image Pam presented of educating a diverse nursing workforce as a matter of health policy centered on the social determinants of health, education, and employment. Up next, we meet a seasoned philanthropist and a foundation executive director who are centering on the individual nurse's journey in a manner that will positively impact all nurses, their careers, and our healthcare workforces, and doing so by applying the nursing process to problem solving and philanthropy.
My name is Elizabeth DeLuca, and I am the founder and president of the Elizabeth DeLuca Foundation. Many years ago, I received an education in the field of nursing and had the opportunity to practice for about 5 years in a veterans hospital in Connecticut. I loved my job. I loved being a nurse. I felt that I could give the best care to my patients and their families. That was 50 years ago. And today I'm in a very different stage of my life and have learned how much can happen in a profession in 50 years. I have the wonderful ability and capacity and mission in my life to help people, help others, and I've chosen to do it through the profession of nursing. Here we are today looking at a profession that has many, many needs. We have been working on an educational front, but we're learning so much about other obstacles or challenges. It is my hope that we will be able to address those and make the nursing profession respected and dignified and compensated, rewarded as it should be.
Hi, my name is Kevin Byrne. I serve as Executive Director of the Elizabeth C. DeLuca Foundation, which is focused on the potential of individual nurses and allied healthcare workers to own and advance their careers and their ability to deliver compassionate, effective care. I joined the Elizabeth C. DeLuca Foundation just over 2 years ago, and what's been most exciting is seeing Liz's vision and passion for nurses and providing those individual opportunities from a very empathetic type of giving that I think is pretty unique with funders.
I think it'd be a great idea to talk a little bit about the Elizabeth C. DeLuca Foundation. It's relatively new.
I think before I can tell you the story of the Elizabeth DeLuca Foundation, I have to tell you the story of the Fred DeLuca Foundation, which started over 25 years ago. and was my husband's idea to help support educational efforts of young people. Both our families were very invested in seeing their children receive an education. Our parents had not ever gone to any higher level than high school, but they wanted their kids, like most parents do, to go beyond what they had been able to do. So we were very focused on getting a higher degree and believing and being instructed over and over again that that was the pathway to being self-sufficient, to having a profession, to being able to take care of yourself in life. And so my belief about education was really very much in line with what my husband believed. So for many years, the Fred DeLuca Foundation supported scholarship funding to students going on to college, which is what we struggle to do in our families. And so for many years, I would say maybe 10, 15 years or so, that was our focus. But when my husband got sick, he had leukemia, and I had quite a bit of time to be a caregiver and see what the environment was like in a hospital setting, in clinics. And, I looked at these caregivers as really kind of incredible. I thought, I'm really interested in what's going on with nurses. So I thought, let me learn about this. Let me go back to the school where I graduated from. And I would talk to the deans of the school, and I would always inquire, how's the school doing? Or what, how many students are we graduating? And sadly to say, I was always told the same number, pretty much, we have about 100 students graduating. And as the years went by, and 25 or 30 years later, I began wondering why this cannot be increasing. And I think that sort of sparked the interest in my nursing focus. Oh, and by the way, I was a nurse myself in my
just
education.
A small little detail,
right?
Little detail there.
Yes, I went to the University of Connecticut and received a 4-year degree of BSN in nursing. Very proud of that, accomplishment, and loved the profession I was in. I practiced for about 5 years as a surgical intensive care nurse, and I loved what I was able to provide my patients and their families. And I felt very rewarded, and it was one of the highlights of my life. And it was really at the direction of my mom, who thought that education was so important. That was her goal in life, I think, is to get her 3 children through school. So she looked at us all and she said, my older sister, you look like you'll be a really good teacher. And you, Elizabeth, you look like you would be a really good caregiver. And in those days, there weren't many professional choices that young girls could make. So you either became a teacher or a nurse. So that's how I got into nursing. I didn't have any other reason except to listen to my mother. So when she passed away, I decided that how can I honor her and all that she worked for to give me that education. So I started a scholarship in her name at the University of Connecticut and continued to support the education of a student with their tuition. Now let's talk 50 years later. Okay, that's where I am now. We've been doing this for about 2 years, and I decided this would be the focus of the Elizabeth DeLuca Foundation. Let's focus on just the nursing profession. And in a way to honor my mom, to honor my husband, and to honor nurses. And that became a real prime goal of mine, was to carry out his wish. He wanted to somehow thank the people that had helped him in his disease process. So that's really how I got to nursing. That brought me again to the University of Connecticut to understand what they were doing. So that scholarship started that effort. I felt that this was very important work, and I'm glad to be able to just have a single focus.
I remember in one of our conversations, you talked about going back to the nursing school and a Shark Tank-like event and watching some of the nurses coming up with some just really common sense, pragmatic, but very smart approaches to thinking about the problems that they see every day and recognizing those skills of innovation.
That was a real light bulb moment for me, because I attended this event and it was a senior year project for the students. And they collaborated with engineering students. Probably there were 5 or 6 students in a group, and they stood in front of an audience of business people, of professionals, doctors, other nurses, academic people, and they presented their project. This is how we can make something better. And first of all, I was so impressed with their poise, their ability to speak to an audience and to present a business idea, not just a nursing idea, but it was something that we can do in nursing to make patient care be better. And their ideas were wonderful. Somebody was selected to have their idea go forward. And there was a manufacturing company that would invest some money to produce a product that they had invented. I just thought, this is really great. Nurses can be proactive in making patient care better. But nobody had ever asked me that before when I was in school, like, how can you make it better? You were just, you were just doing it because you were taught to do this. And I've always been a lover of following the rules. Just follow the rules and you're fine. So I didn't think about creating change, but that was very inspiring to see how nurses could be effective in that capacity. And that's a very important thing for people to remember, is that they are the caregivers. They're constantly with the patient. They spend more time with the patient than other healthcare professionals. And they see the improvements that can be made, and they need to be listened to. That's really, really important. So that inspired me to provide support for a professor who began teaching innovation and supporting new knowledge in nursing. I don't think that had ever been part of the curriculum. It is today, and it is presented already to the freshman class. They get more of it as they go on. I think it's very, very important that the nurses are understood, listened to, acknowledged, and that we support that kind of innovation.
As Liz shared, I think that example of funding a professorship in innovation helps advance the nursing curriculum to some of the innovation she saw in the examples of the Shark Tank example at UConn. And again, bringing that innovation in for a practice-ready nurse.
We've had a great deal of learning in our foundation. I realize there has to be other ways to fix the nursing shortage or the departure of nurses from their profession. So we retained a consultant to provide us with just general knowledge and look at what's really happening in the profession. And one of the things we learned is that nurses don't really see a pathway for them to move forward, or what other options there are, what else you can do in the field. Yes, you can go on to get a master's degree or a PhD. Maybe you can go into research or academia. Then you say, well, what's next? How do I advance? Where do I go? How do I improve? And in many other professions, there are pathways. And I think in nursing, it's sort of like I feel it's a stumbling block. There's an obstacle there. We're not doing a very good job to provide pathways or educating nurses what those pathways are.
Again, one of the advantages of having Liz's experience as a nurse is around simulation centers and making sure that those simulation centers are fully utilized. She'll cite the examples of, nurses come out, they'll have to work night shifts, but a lot of the simulation centers aren't open in the evening. It would be great if that nurse could start to practice of, providing that care at the hours they're going to likely start their career. So obviously technology is key to the future of almost every career, but especially in healthcare and nurses. What's exciting about this opportunity with blending technology with nurses is how it can expand their training and be a tool for good. There's a lot of news stories around artificial intelligence or AI replacing nurses. We don't see that happening, but we do think AI and technology could help benefit the nurse. We're really hoping that we can harness it for the growth of the individual nurse. We want to make sure nurses are operating at the top of their license. So again, that nurse can provide that human-centered care going forward. So again, I think there's been different things from the professorship, expanding the curriculum, growing also the size of the classes, opening up the nursing profession to more individuals who wouldn't have had access before. That's all part of our strategy moving forward.
One of the things that I think is so beautiful is this statement that you have, which is that the Elizabeth C. DeLuca Foundation believes deeply in the potential of individual nurses and allied healthcare workers to meaningfully own and advance their careers and their ability to deliver skillful, compassionate care. When I hear you say that we have one sole focus and you talk about being centered on individual nurses, that is an outlier in a beautiful way. And I'm wondering if you and Kevin want to speak to, the things that you're learning and what it means to be centered on individual nurses and a nurse's career and a nurse's career journey.
So for us, it's important to be centered on individual nurses because each nurse's journey is different and unique. So one of the first things we did in looking at the strategies and going back and reflecting on our learnings was developing this mapping of what we call a nurse's journey. And so there's 3 key stages there. There's the root, grow, and bloom. And in root, it's about embedding that desire to be a nurse or making sure individuals from rural or remote communities have the same access to get into healthcare, allied healthcare, and hopefully ultimately nursing. But a lot of the investments, and again, as the American Nurses Foundation report highlighted, a lot of the investments have been in that early stage on education and getting nurses prepared. Where we see a lot of opportunity is in the grow and bloom stage. So in the grow stage, it's that early career nurse, making sure that they feel well prepared, again, practice ready, that they're starting to develop on their career path. And then in the bloom stage could be that nurse that has a lot of experience. How do we take advantage of that? How do we ensure those learnings and connections are coming back to younger nurses in their career? So we've tried to connect those across, and also want to emphasize it's a both and. We're continuing to invest in the education side and the College of Nursing. And we also feel like there's a lot of opportunity in the professional path of each individual nurse.
Every individual has some different journey that they're going to go on. But whatever impact we can make in either nursing education or nursing workforce or nursing perception, it will impact every single individual nurse. And I think people really underestimate the value of nurses. I have the ability and I have the desire and I want to do something that will impact how nurses are treated, listened to, learning a whole different side of, what happens after you get through that training. Well, first of all, the training might need to be changed. We're living in a whole different world today than 50 years ago. Let's train the nurses for what they will be facing when they get out there on their jobs. So the educational side is one thing. Also, we need to focus on what is happening on the other side. Are employers respecting those positions, those people? Are they valuing their employees? Are they compensating them well? Are they providing reasonable work conditions for them? It's a pretty hard profession. You're running and you're taking care of a number of patients. You'd like to have less because you want to give better care. That's always the desire of a nurse is, how can I give the best care? And that's what they feel guilty about. They sometimes work in conditions where they feel they're not doing their best and they know they should do better. But all right, I'm getting a little bit off target.
No, you're actually right on target, because so many times when we look at gifts or investments, we look at investing in nursing, the whole workforce or the profession. What I see that's quite different and unusual in a wonderful way is that you're very focused on the nurse in the nursing workforce. And that is a huge distinguishing difference. One of the other things that's quite different is, the way you're approaching the business of philanthropy. You actually bring a nursing lens, a nursing process. The way you look at this and the way you're learning is the same way we take care of patients. We assess, we plan, we implement, we go back and we evaluate. And you mentioned the word that as a foundation that we're learning a lot, and you come into it with a great deal of humility, a lot of questions, and are novel in the way that even if something doesn't exist, you understand what certain needs are. And so you're going out as a foundation and saying, what are the needs? Not so much the solutions, but what are the needs and how do we craft an investment that's going to address the needs. And it's very centered on individual nurses that then impact the entire workforce. You have shared that your nursing training, your education, that nursing process has served you well in your business relationships, your personal relationships, when people have needed assistance and care. I would love for you to say more about the lasting impact that nursing education has, no matter where you decide to take your career.
I'm so glad you brought that up because I did want to talk about that. I keep talking about it to almost everyone I meet when they say, oh, this is a really different way to approach the problem. It was drilled into us as students. You are going to take care of someone. They are going to have some sort of symptoms. You have to figure out a plan of care. Basically, you are looking at the patient, or let's say situation. Okay, let's assess what's going on here. So you're kind of diagnosing it. Let's assess. And then let's figure out, what should our plan be to take care of that wound, or to, address the pain. Let's see, why is the pain happening? What can we do? How can we make you more comfortable? You have to have a plan. And then you have to evaluate that plan after you put those, that practice into place. And then you evaluate. Because maybe the plan wasn't good. You've got to go back and change it, add more things, or go on to a different plan. But that is how we actually, that is a learning that every single person gets value from, because you could be looking at your marriage, you could be looking at your life, your profession. You're always looking at, let's assess, let's make a plan, and let's evaluate. I almost do that in everything. I think about everything. It works. It's a really good recipe for getting to the solution.
The training sticks.
The training sticks. I can't get it out of my mind. I can't get rid of it.
In the role as a philanthropist, and when you've talked with other folks in philanthropy, do you find, clearly you're
Absolutely.
using...
I know the question you're going to ask. Yeah. I absolutely use it in our philanthropy efforts. Like, let's assess what somebody is doing. How can we help them? What could we do to help them? Right. And then let's put that into place. Let's see how it works. And then let's evaluate.
I think that in innovation for philanthropy, apply the nursing process. Maybe all philanthropists should be using the nursing process.
Yeah, that's a good idea, Shauna. But nobody has anybody really looked at maybe they have looked at what the problems are, but we're kind of digging in to see what are some other symptoms of this disease.
And clearly we're underinvesting in nurses because there is wide agreement across multiple organizations, reports, evidence that investing in nurses is a way to invest in the health and well-being of citizens everywhere. So while there's wild agreement, and a lot of evidence to support that, the action's actually not happening. So when you're looking at that, Liz, when you saw that report from the American Nurses Foundation, the headline was that nurses are receiving 1 penny out of every dollar that goes to healthcare philanthropy. How did you read that report, and what did it mean for you guys?
Well, I think for me, it meant that this is a dismal figure. If we're trying to make some improvement in any major area, and healthcare is a major area. It's a huge ship. And I think, well, maybe people don't know enough about what's going on and that there is a problem to correct. It's an interest I have to find people who are also as passionate about this subject as I am, and I'd like to do more. I think collectively doing something is better than doing it singly, alone. So it's my intent to meet with other people who have my interests as well, and to form some sort of a team. You can't just have a general. You need soldiers. You need people to take this on. It cannot be done alone.
And I think one of the best ways to bring other funders along is show the return on that investment, on that grant. And so the investments we've done have focused on, for instance, like leadership and the Chief Nursing Officer Institute. So again, these are nurses from around the country who are in different stages. They may or may not be ready for that Chief Nursing Officer or CNO role, but maybe they're starting to get into a leadership role and they have not had leadership training. So this institute provides that. We're providing scholarships actually for them to attend, because a lot of times the employers won't make that investment again in that individual nurse's journey. There's a dearth of opportunities for nurses to find their own path, not coming up with something generic, but where each nurse is in their journey, ready for additional leadership training. We want to be able to provide that. There's also some things we're doing with like Career Village. It's a AI-driven coach platform that's specific to nurses and nursing. So I think it's really hard to go out and just search for information on nurses. You don't know if it's valid, vetted, curated. And so Career Village is developing this specific platform to nurses, in that root stage of finding out about the different career opportunities for nurses. So nurses know where to go to nursing school or the type of training they would like, but also that early career. Because again, back to nurse leadership, depending on the turnover of nurses in that unit or in that organization, they may or may not be able to benefit from all those years of experience of the experienced nurse, and helping provide that exposure to the careers early on and some of that wraparound support for nurses, not just in nursing school, but again in their early careers, that we think are exciting for additional funders to come along. And then finally, also would say finding ways to educate and train nurses in the communities they're from. What we found in our past grant making is if you pull a nurse out of that home community, our home neighborhood for nursing school or training, then that nurse usually doesn't go back, even though that may be the community that nurse cares most about. And so trying to bring that training and education to the nurse in their community.
The community nurse residency program, that is novel. That is, and so needed. Can you share a little bit more about what you're doing on the early end of helping nurses to be practice ready?
Yeah, the community nurse residency program really fits in our strategies around trying to connect both the academic training and the clinical situation of nurses. So again, a nurse that wants to go into a federally qualified health center, FQHC, or more of a community setting, that's a different skill set, to Liz's point, a different reality of day-to-day work. And so there's actually a dearth of residencies for nurses compared to medical students who have exposure to these residencies. We're trying to bring that model to nurses for, again, the individual paths they may want to pursue. Every nurse may not want to go into a hospital early in their career. Again, back to they may have a passion around their community and they want to stay in a community health center local to them. So again, that community nurse residency program is one that we're hoping will be a model that we'll create from scratch. So I think there's a lot of opportunities for funders to see their interest in this journey. Again, if it's a K-12 or secondary education funder, there's a lot of opportunity in the root stage, making sure that especially young girls, females, are exposed to STEM careers in elementary and middle school so that they are prepared to go to nursing school. If somebody's interested in leadership or professional development, maybe from the business side, there's a lot of opportunity in the growth stage to come in and bring some of those principles in. We do think there's a lot of opportunity through this nurse's journeys for people to join us.
I do want to mention something really transformative. Your most recent gift to the University of Connecticut UConn's School of Nursing. It was the largest gift that the university has ever received, and I went to the School of Nursing. That in and of itself says so much, Liz. You were talking about how people underestimate the value of nurses and nursing. Making such a statement like that to say, here is a transformative gift, the largest that you've ever received, and here's what it's going toward. I would love for you to share just a little bit more about that gift, what your thinking behind it is, what your hopes and aspirations for it are.
Giving that gift showed my belief in what the school could do, and hoping what the school will do, and giving it an opportunity to shine and to be most modern, up-to-date facility, beautiful center of learning, a building rather than just some old brick building that was over 100 years old, doesn't really signify the wave of the future and, what the health field of the future is looking like. We have to be in a future way of thinking.
That gift didn't develop because it was a large amount or they needed a new building. The conversation was around Liz would share, it seems the same number of nurses graduating 50 years ago. There's a shortage. There's a huge number of highly qualified applicants to UConn that can't get in. How do we provide opportunities for those individual students? How do we grow the School of Nursing? How do we innovate the curriculum? And that's really the perspective that grant came from and developed into the gift that you mentioned. But I think what I really appreciated is it always starts at the individual, and in this case, the individual nurse, and what's best for their journey.
I have a lot of allegiance to the school, and I believe that this profession is worthy of investment. And I hope that this will be a premier learning center. And I've worked to convince the government officials to say, yes, nursing is important, healthcare is important. Let's invest in this as well. So it isn't just my investment, because it certainly has also been enhanced by the investment of the state. It's a state school. So I think, again, I see it as, okay, we're working together to get there. I'm not working alone. But to have somebody just come forward and say, look, this is a great investment. We need to invest in healthcare, and let's do it, and just get going. Let's get going. I'm impatient. And so I'm hoping that the school will open in a few years. Hopefully we've committed to about 2 years. So we'll see what happens. But, everybody can work a little faster if you push them a little bit. Like, okay, let's get rid of the obstacles. Let's move this along. Let's have those deadlines in place. Let's follow the formula. Let's keep going. You just have to push a little bit. And so, yes, I do. I will see it. Yeah. I know I will.
It's very much aligned with your values and who you are. It's a significant gift. And going back to the report, so many of the things that it talked about, this particular gift really personifies. Number one, it's urgent. Number two, it's massive. $40 million says a lot. Number three, the report talked about the investments can't just be from philanthropy. You have a government partner. The state is coming in. You're funding not only the future, who are these nurses that we're going to attract so that we can root and we can bloom? We're in their communities. I think another thing that was so important was that you looked at the shortage of clinical educators. This provides funds to hire and have those clinical educators in place. And then to bring in the technology, to bring in the innovations so that we're preparing nurses so that they can walk into the different types of care delivery models that you guys are helping to support. And I think it takes the insights of somebody who has been a nurse to really appreciate all of that. Your connection to the people who are practicing nursing, who are in these really hard work environments, they hear in your voice and in your words that you care. And, these gifts, the gratitude is going to show up in their smiles, in their work, and in the care that people experience. So I'm going to tell you on behalf of 24 million colleagues around the world, thank you. We love you. We see you. And we feel so seen through these gifts that you're making.
Thank you, Shauna.
Special thanks to our episode guests, philanthropist, president of the Elizabeth C. DeLuca Foundation, and proud UConn School of Nursing alum, Elizabeth DeLuca. Kevin Byrne, executive director of the Elizabeth C. DeLuca Foundation. Nurse Pam McHugh, founder and chief executive officer of the groundbreaking Nurses Middle College. From Bloomberg Philanthropies, Jenny Kane, who oversees their career and technical education healthcare initiative, a $250 million investment in 10 locations around the U.S. to help build new, innovative high schools to train young people for growing healthcare careers. And we started off our series and this episode with insights from Kate Judge, who is the recent executive director of the American Nurses Foundation, who commissioned the first ever report on philanthropic support for the nursing profession. We invite and encourage you to listen and share episode 106, Investing in Nurses, Insights in Action, the first in our series. Up next, with Investing in Nurses.
If you're just filling the buckets with nurses and getting them interested in this amazing profession, but you're not focusing on their workplace and you're not focusing on helping them thrive, you're not really solving the problem.
And that's why the Johnson & Johnson Nurse Innovation Fellowship is so important. We're training senior nurse leaders, chief nursing officers from hospitals all around the country with this innovative mindset. They're learning about human-centered design, they're learning about equity-centered design, leadership and business acumen skills through the lens of innovation.
Our focus has been to invest in a way that's relevant and also to recognize and appreciate that over the years, the needs of nurses have shifted and how we support and champion nurses as a result has needed to evolve.
When you have such a remarkably untapped resource, it deserves additional attention.
These are things that require deep, enduring commitment.
I tend to think in these big terms, but that's why I find nursing compelling. Nurses are key to not only better care, but who we are as human beings at our best.
For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.